Hello dear patients, today we are going to review the clinical case of brown spots on legs. A man came to our clinic with complaints on appearance of brown spots in the area of lower extremities. They appeared after cold, when he had teraflu and other medications. So there was an appearance of such spots and gradually they increased in numbers, but they didn't fuse and remained the brownish spots on lower extremities. This man was 43 years old, and as I said, these spots appeared after the intake of non-steroidal anti-inflammatory medications and antiviral medications. Initially, on observation, they were small hemorrhagic spots, that is, spots with penetration of blood into the skin. Their size was relatively small, 3 to 5 millimeters. They almost didn't fuse with each other, and as I said, the color of fresher spots was more red. The old rashes that this patient predominantly had were of reddish-brown, yellowish-red color as is seen on the picture. As for other symptoms that bothered the patient except for the presence of these spots, there was some itch in the area of rashes that also bothered the patient. On observation, it was seen that these spots are hemorrhagic, so a diagnosis of Schönberg's disease was set to the patient. This is pigment purple dermatosis. Roughly speaking, this is an exit of blood from small vessels into the skin. So a subtype of bruise blossom is observed. These are metamorphoses of color. First they were more red than a brown, sometimes blue color of such rashes. The course of this disease is chronic. In our case, the patient did general blood analysis, immunoglobulin E, circulating immune complexes, and eosinophilic cationic protein. However, all these analyses were normal. About 5-6 months have passed since the event of cold. That's why all blood analyses were normal. After examination, vascular medications were prescribed to this patient, like Trintal, Doxium, intravenous zone, vitamin C medications intramuscularly. Apart from that, tetracycline medications were prescribed internally by type of minocycline, 50 mg 2 times a day. The patient had this treatment for 15 days and the color of rashes changed into a more brownish side. They became more red. Singular rashes resolved. In 15 days after treatment, the patient was taken for observation with a necessity of repetitive course within 1.5 to 2 months after the primary one, as antibiotics and vascular medications required taking a break between such courses. Apart from that, external glucocorticosteroid creams were prescribed to the patient, and they were prescribed for the time of such break in treatment. This disease usually has a chronic course, and often it doesn't resolve completely. That's why here it's important to observe a patient and to carefully watch the medications that can induce aggravation of this disease. If it is necessary to diagnose and treat different skin diseases, including spots on skin, pigment spots, you can consult dermatologists of our paid medical center of Dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of skin diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.